The waters of the Moi River mark the border between Myanmar and Thailand. In this remote area, a strain of drug-resistant malaria has emerged that threatens to set back efforts to contain the disease around the globe. Part of the problem is that people move freely between a country that's managed to control malaria, Thailand, and one that has not, Myanmar. Every day, Burmese cross the river to shop and to work in the rice and sugarcane fields in Thailand. Other Burmese exiles live permanently in Thailand, having fled the lengthy civil war in their homeland. And as people move between these two countries, malaria moves with them, making containment almost impossible. At a clinic run by the Shoko Malaria Research Unit on the Thai side of the border, most of the patients are poor migrant workers from Myanmar, also known as Burma. 5 or 6 years ago, 90% of the patients at this clinic came in for malaria. Now, most of the patients are being treated for something else. This is in large part due to a relatively new family of medicines containing artemisinin. These drugs have dramatically reduced the number of malaria deaths here and around the world. But then a few years ago, doctors noticed something troubling. Though the overall number of cases were declining, there was an increasing number of patients who were showing resistance to these powerful malaria drugs.
Before 2008, most of the patients, they clear of the parasite within 48 hours of the treatment. But now, more than 75% of the patients, they did not clear the parasite, even on the last day of the treatment.
At the Wanpa clinic, staff closely monitor malaria patients to prevent the most common cause of resistance, people taking drugs improperly. In the mid-20th century, resistance to other important anti-malaria drugs started in Southeast Asia and then spread around the world. This development severely undermined what had been two of the most powerful malaria medicines of their time. Researchers worry that this current resistance to artemisinin in Cambodia, Thailand, Myanmar is about to follow that same pattern. And doctors in the region say the loss of artemisinin-based drugs could be disastrous.
We will be in a very bad position because malaria will be on the rise and we have almost no drug to treat it.
In the Thai city of Mae Sot, most Burmese go to the Mae Tao Clinic, founded by exiles 23 years ago. The civil war on the other side of the river has left the health system in Myanmar in shambles. So every day, hundreds of Burmese come here to seek treatment for malaria and other ailments. Muge Pa came across the river from her farm this morning with a pounding fever. A blood test showed that the 17-year-old is suffering from malaria. If treated quickly with the proper drugs, the potentially fatal disease can be easily cured. People on both sides of the border here regularly use packets of a local remedy called yachut to treat various ailments, including malaria. These makeshift satchels, prepared by local shopkeepers, are inexpensive, but also at times contain ineffective drugs.
We need to educate not only the patient, but also educate the shop owners. I mean, they can sell the drug, but they need to sell in the right dose and the right drug.
In Thailand, pharmacies no longer freely dispense malaria drugs as part of an effort to curb the growth of resistance. Back at the Mae Tao Clinic, Daw Keen Tway and her husband illustrate another problem with controlling resistance in this region. They've been living on this side of the border illegally for 8 years, and she says she rarely goes to the clinic. $100 baht is about $3 or a full day's pay for most migrant workers. Her hesitancy to travel just a few minutes from her house to the clinic not only affects her, doctors say, it means that the malaria parasite has more opportunity to spread in the community.
There is a problem of population living on the borders who don't have access to good health care. Clearly, it's very worrying because these drugs have been very effective and essential into reducing transmission and treating patients.
The Mela refugee camp, just an hour north of Mae Sot, illustrates Nosten's point. Simply by providing accessible, free health care, malaria has been practically eliminated in this settlement of 40,000 Burmese refugees.
So the chance of getting malaria in Mela is still there, but it's quite low. As in the villages, it's much higher, and also in Burma, it's much higher.
In Mae Sot, longtime health official Sunmarit Bunpeng says the border is a key stumbling block to controlling malaria throughout the region.
ทั้งฝั่งไทยหรือฝั่งพม่าซึ่งตอนนี้เราก็ไม่รู้ว่าทางฝั่งเขาก็ว่าคงจะมาติดในประเทศไทยทางเราก็ว่าติดทั้งประเทศเขาคือมันชี้ไม่ได้ว่ามันติดกันที่ไหนแน่เพราะว่าฝั่งเราก็มีฝั่งเขาก็มีอย่างนี้นะครับ
What is clear is that the disease will never be contained unless it's controlled on both sides of the border.